Is back pain preventing you from getting on the floor? Not anymore. Hi, Dr. James Vegher here. I'm a specially trained doctor of physical therapy who focuses on helping people solve their joint pain issues. Pain in your body can prevent you from doing things like exercising or other everyday activities, but it doesn't have to anymore. I'm here today to show you how to work around your back pain and still get your body moving, all off the floor. But I'm not going to stop there. Simply stick around to the end of this video to get exclusive access to a free gift I've created for people just like you. I've created a short quiz designed to identify your individual joint pain problems that are preventing you from getting down on the floor and give you a personalized recovery plan. First things first, if you're having pain in your back that is keeping you from getting onto the floor, don't. Any exercise that I show you in any of my videos that involves you getting onto the floor can be done on your bed. The firmer the bed, the better. If your bed is soft, think about the bed in your guest room. If you have a sturdy table that can support your weight, that is good too. Now, if your back pain is preventing you from getting onto the floor, that tells me that your back is doing more work than it should to move you. This exercise is about controlling your middle better and trying to teach it to stop doing as much work. All right, let's get started. But first you need to know that this movement is intended for a broad audience and you may require more specific attention. Also understand that if I was working with you one-on-one, I would be able to provide treatment and guidance on all the facets of your pain. There is much more that goes into solving your problems that encompasses your whole body, and I encourage you to check out my other videos for a more comprehensive approach to solving your pain problems. So now to the exercise. This exercise is really designed as a way to get your trunk muscles to all be coordinated and controlled so that they can keep you still and not overwork the muscles in your back and in your trunk. There's a little bit of coordination that's involved here, as well as challenging how you're putting your muscles together and some strength components. And the best part is it can be done on your bed. So this is where I recommend you start. If you have a mattress that's a little bit older and you have sort of worn that little divot in the mattress from where you sleep, then lie across the bed instead of where your head usually goes, lie across your bed the other way. This will create a little bit more of an even and firm surface for you to do this exercise. Ideally, this exercise would be done on a more firm surface, so a table, a massage table if you have it, but a bed will work just fine. You're not going to be really losing anything in the experience or in the way it's going to help your body. So let's start by lying down on the back. Okay, so here I am sitting on a table, but if you sit on your bed, again, it's fine. And this exercise is about learning how to control your trunk the right way with as minimum amount of muscle force as you need to accomplish the task. I'm going to have my arms and legs up in the air, and they're going to be positioned in a very specific way. And then I'm going to ask you to move your body as a whole unit and slowly turn from one side to the other. And this is going to activate all the muscles in your middle, in your trunk, so that they can coordinate and you can learn how to let go of the muscles in your back specifically so they're not doing as much work. This looks really simple, but it is quite challenging. Even people that have a lot of traditional core strength or a six-pack abs, they have difficulty doing this exercise correctly. So if you're struggling with it, that's fine. Part of exercise is getting a little bit of a struggle, but don't let that dissuade you from actually doing the work and practicing it over and over again. So I'm gonna go ahead and lie down. First thing I want to do is make sure that I am telling my body how to stabilize itself correctly. So I'm gonna just create a small push with my stomach out, almost like you're making Santa's belly. It's a little counterintuitive, but this sets your mind up to know that it needs to control your middle in the proper way. So imagine just pushing your belly button up slightly. It's more at an angle towards your knees. So if my belly button was pushed more toward my knees like this, and I'm gonna keep that pressure in my stomach the whole time that I'm here. And it will happen naturally as you practice more and more. The next thing I'm gonna do is I'm gonna lift my legs up to about 90 degrees. And when I do that, I'm gonna keep my knees slightly wider than my hips and rolled out. So we don't want this happening, and we don't want it to be excessive. Just slightly out. Next, my arms are gonna be floating in the air like this. And I want you to think about very supple arms, gentle. They shouldn't be rigid and straight this way. They should be relaxed, shoulders towards the floor, elbows slightly bent, and hands relaxed slightly, not rigid fingers. From here, I'm just gonna think about initiating the movement from the middle of my body and turning slightly to one side. Just like this. Holding it for a second, and then come onto your back, and then the other direction. The movement should be initiated from your side, and then onto your back. Another key point to keep in mind is that your arms and your legs should maintain the relationship to one another. And the legs shouldn't be going first, the arms shouldn't be going first, and I don't want the legs and the arms coming closer together or farther apart, and they shouldn't be coming closer to, my hands should be coming closer to my knees or farther away. My knees shouldn't be coming up this way. I want to keep that same alignment. So for some people, especially if you're new to this movement, or this is a challenge for you, what will happen is you'll feel your chest let go like this, and you'll open up, you'll lose that contraction and pressure. And so the point here is to maintain it. So only move as far as you can move without letting your back go. For some people, that's only a small amount. And that's fine. Because we're working on coordination, we're not working on range of motion here. We're trying to get the muscles in your back, again, to let go and not do more work than they were designed to do. So move easily and only move as far as you can move correctly and well. There you have it. Be sure you listen to your body and stop immediately if you experience pain. Pain is your body's way of telling you something is wrong. As promised, I have that special gift for you. All you have to do is click the link down below in the description, and it's going to take you to a page where you can fill out a quick quiz to help me identify your unique needs and get you a personalized recovery plan. I would really love your help with leaving me some feedback down below in the comments as well. Let me know how these exercises felt for you. What struggles did you have? Any questions about the way you're doing the exercises or about getting off the floor? Be sure to click the subscribe button so you can get even more pain relief and corrective exercises and tips. And remember to give this video a thumbs up and share it with a friend or family member who could use help finding exercises that work for them. Until next time, take care of yourself.